Okay, so we're moving into the second step in our disc rejuvenation system. We've gone over how we use decompression to open up the discs and help re-imbibe the discs with nutrients. What we're going to go over now is some specific gentle adjustments that we do to restore proper motion and architecture to the joint. Now, the joints in your lumbar spine, especially at the bottom, are designed to have a big curve in them. That allows for shock absorption. It also allows for great mobility and for strength. However, as you have injuries to your lower back, you can wind up losing that. That's why it's super important for you to work with a corrective chiropractor to assess that and to understand if we need to work on remodeling your spine when you've had lower back injuries or problems. One of the types of adjustments that we use for our patients who have L4, L5, L5S1 disc injuries winds up being some gentle pumping mechanisms, as well as using tools to help with changing that and adjusting the spine. So the adjustment that we'll typically wind up doing is on a table just like this, where we'll gently elevate the hips and the pelvis to wind up helping give that position they should be in, that big lumbar curve that you should have. And we wind up utilizing just some gentle pressure to allow for those discs to get more nutrients and to help almost similarly to how we do the decompression, but on an individual segmental level. We look for feedback from our patients on how they're responding to this to help create mobility and to allow those discs to have pressure released. In addition, we may wind up using one of our tools like the arthrostim. That's what this tool is right here. It's super gentle and allows for us to wind up providing specific adjustments to the individual segments that may be irritated and to avoid segments that we don't need to adjust. This helps for that lower back to start to get the mobility that it winds up needing so that it can wind up moving right. So that second step in this process is specific adjustments and pumping of the vertebrae to allow for proper mobility and to start restoring the proper curves to your spine. The next step, we'll go over the tissue rejuvenative therapy that can spark healing and get you back to where you want to be.